Hi, this is Pauletta Irwin, Unit Assessor for CN6, aka Pauletta Little Boots, coming to you from Second Life. Just thought I'd put together a short video clip, a lecture if you like. Given that I didn't get the opportunity to speak to you as a group about this sort of stuff prior to you going out on prac, normally I would speak to the cohort as a whole during the first intensive. But given that the intensives were shortened this year, I didn't have that chance. So here we go. It's hard to look at this picture once you know what it is and not laugh and have a little giggle, but I'll try. It's a tobacco smoke enema kit. I just wanted to bring to your attention how far we've come in treating traumas. To the physicians of the time, which is around the 1700s, the appropriate treatment for apparent death was warmth and stimulation. Artificial respiration and the blowing of smoke into the lungs or the rectum were thought to be interchangeably useful. However, the smoke enema was considered to be the most potent method due to its supposed warming and stimulating properties. Patients were also given rectal infusions of tobacco smoke as a respiratory stimulant. Richard Mead was among the first Western scholars to recommend tobacco smoke enemas to resuscitate victims of drowning, when in 1745 he recommended tobacco glisters to treat iatrogenic drowning caused by immersion therapy. His name was cited in one of the earliest documented cases of resuscitation by rectally applied tobacco smoke, and from 1746, when a seemingly drowned woman was treated. On the advice of a passing sailor, the woman's husband inserted the stem of the sailor's pipe into her rectum, covered the bowl with a piece of perforated paper, and blew hard. The woman was apparently revived. Now, it brings a lot of things to mind. Love for one's husband and wife. No, of course we'd all do it. It also brings up the old saying about blowing smoke out one's ass. Maybe that's where it originated from. I'm not sure. Why am I telling you this? I guess I want to highlight how far we've come medically. Nursing, what's changed? We need to know how to work all the bells and whistles and all the equipment that has been introduced so that we can look after our patients better. But there's nothing like holding a hand. No one else is going to do it. There's nothing like explanation. There's nothing like kindness. There's nothing like humanness. And that all comes from nursing. And that's been around for years and years. And hopefully it will be for many more. I don't want you to lose sight and get lost in the technology. Don't forget you're a nurse. To highlight this point, I'd like to use the words of Sam Bailey, who has written a book. And I've just got a PowerPoint slide here that I'd like to run as I roll through and read his words. It'll really highlight the point for you. Okay, so here we go. A man, oh, hang on, I'm on the wrong page. 1 minute. Okay, that's all I saw before being thrown violently out of the back window. At that point, there's a permanent void in my memory. I don't remember being thrown out of the window. I don't remember anyone screaming. I don't recall hearing the crunching of the steel car body yielding to the uncompromising hard, dry earth. A few moments I've lost forever. Perhaps I lost consciousness, or perhaps my brain chooses to forget. We tend to shut out the worst of it in most events of extreme emotion. I couldn't feel my bruised body lying on the packed earth. I couldn't feel the shirt on my back or the boots on my feet. There was no searing pain from a broken limb, no throbbing cuts or grazes. Nothing. Then I tried to get up. I was sending out the signals from my brain, but there was no answer. The phone was ringing, but no one was home. A man and a woman, tourists I guess, were by my side speaking to me, giving words of comfort and support, oozing worry and concerns. I remember saying to them, "Gee, I hope I don't spend the rest of my life in a wheelchair." For me, a few hours down the track, things hadn't improved at all. I still didn't have any sensation in the lower part of my body. At Mount Isa Hospital, I spent most of the night in X-ray, being photographed from head to toe. The X-rays revealed a dislocated right hip, a broken neck, and suspected spinal cord damage. Apart from that, I had hardly a scratch. My experience at Mount Isa Hospital is one I'd like to forget. The staff were very impersonal, and all the tests left me feeling stripped bare and placed under the spotlights for everyone to prod and poke. I was manhandled from here to there and back again, like a dead carcass at an abattoir. Hardly a word was spoken. My worst moment came after the tests were finished. As I lay there in shock and confusion, a male nurse shaved the front and sides of my head. He also cut off my jeans and my shirt. The whole procedure, no doubt a regular occurrence for him, was done in complete silence. There wasn't one word of explanation, not one word of comfort, not even a greeting. Then a doctor approached and pushed needles into the bald skin above my ears. I felt a sharp sting, instant like a paper wasp, which I later realised must have been a local anaesthetic. Again, no one spoke to me. It was surreal, as though I was the starring role in a black and white silent movie. Next, he made incisions behind each of my temples and placed skull tongs on my head. The steel arms rested against each other, against each side, over the areas that had been shaved bare. I remember the doctor did say a few words to me in very limited English. His bedside manner only went as far as suggesting the next procedure, quote, might hurt a bit, unquote. He wasn't bloody wrong. Suddenly I felt an explosion of pain unlike anything I'd experienced in my life before. It was a bit like having a red-hot poker shoved into my brain, turning it to mush. A nail, similar to the size of a tack, but sterilised of course, had just been hammered, literally, into my skull. Until then, I hadn't experienced much pain, no doubt because of the spinal cord injury. Now I thought I had gone to hell and back. It felt as if someone had let off a bomb deep inside my head. Then he did the other side. By that time I wanted to slip off the ends of the earth into oblivion. It must take a lot of pain to kill you. I now know the doctor was putting me in traction to help keep my spine stable and prevent any further damage. I don't think I could have faced any more at that point. As it turned out, though, I would be subjected to this procedure twice more over in the next week, initially because the tongs had been put on backwards at Mount Isa Hospital. I spent the rest of that night in intensive care. It was one of the longest nights of my life and one of the loneliest. I had just been living and working in the outback, mustering stock, hundreds of miles away from anyone, any town, any village. Never had I felt so alone. Here I was surrounded by nurses and doctors, people who had chosen to dedicate their lives to caring for others, and I felt alone and forsaken. But the nightmare of that night in Mount Isa wasn't over just yet. Just when I thought things couldn't get any worse, a nurse came in and told me she needed to put a nasogastric tube up my nose and down into my stomach. She forced the tube inside, its rough edges scratching the tender flesh of my nasal passage as she tried to push it into my esophagus. I kept gagging on the tube and struggling to escape the pain. By then I was wondering how much more I could take. Eventually, a female doctor came to help. She was like an angel straight from heaven. She held my hand and spoke kindly. Her warm touch and words of comfort helped so much. She was the only medical person who reached out and gave me solace during that first horrendous night. She explained that I had to have the nasogastric tube inserted because they were flying me to a bigger hospital in Brisbane for more treatment. It was pretty frightening at the age of 19 to be thrown from the fun and tumble of life as a seemingly invincible 6-foot-tall and bulletproof jackaroo in the Northern Territory into this nightmare. In less than 24 hours, I'd survived a traumatic and violent car accident, been carried on a mad road dash to a waiting Royal Flying Doctor Service aeroplane, had emergency plane flight, and then been subjected to x-rays and painful surgical procedures in a huge, impersonal regional hospital, and all with very little compassion. The pictures that you've just seen are from Sam Bailey's book, and the experience that he just had, sadly, happens more often than I'd like to admit. That's why I'm sending all of you out as new nurse practitioners next year, and you will hold the hand and you will be the voice of the angel that explains things. Isn't that awful that from the time of the accident, people who didn't even know him, who were passers by and tourists, gave him far more comfort than any nurse did, or any doctor for that matter? Pretty sad stuff, but something that hopefully we'll all learn from. Whilst the next clip that I'm going to show you has very little, if indeed anything, to do with nursing, I think that it demonstrates how easy it is to change. So I'll just get this ready to show you. Okay.
I am part of a lost generation, and I refuse to believe that I can change the world. I realize this may be a shock, but happiness comes from within is a lie, and money will make me happy. So in 30 years, I will tell my children they are not the most important thing in my life. My employer will know that I have my priorities straight because work is more important than family. I tell you this, once upon a time, families stayed together. But this will not be true in my era. This is a quick fix society. Experts tell me 30 years from now I will be celebrating the 10th anniversary of my divorce. I do not concede that I will live in a country of my own making. In the future, environmental destruction will be the norm. No longer can it be said that my peers and I care about this earth. It will be evident that my generation is apathetic and lethargic. It is foolish to presume that there is hope. And all of this will come true unless we choose to reverse it. There is hope. It is foolish to presume that my generation is apathetic and lethargic. It will be evident that my peers and I care about this earth. No longer can it be said that environmental destruction will be the norm. In the future, I will live in a country of my own making. I do not concede that 30 years from now I will be celebrating the 10th anniversary of my divorce. Experts tell me this is a quick fix society, but this will not be true in my era. Families stayed together once upon a time. I tell you this, family is more important than work. I have my priorities straight because my employer will know that they are not the most important thing in my life. So in 30 years, I will tell my children, money will make me happy is a lie, and true happiness comes from within. I realize this may be a shock, but I can change the world, and I refuse to believe that I am part of a lost generation.
It's pretty amazing, isn't it? I love that clip. Um, as I said prior to it, what's it got to do with nursing? I hope that you can just see from that a patient's journey. Think about it. Looked after by a nurse who doesn't speak, doesn't smile, doesn't address them by name, walks up to the bed and focuses on the IV equipment rather than looking at the patient's, face. God forbid. You're allowed to touch your patients. You can see how easily it would be to change somebody's journey. I'm not saying that we need to forget all the stuff that we've learned about for the last 3 years, but I guess let's remember the stuff that we learned basically when we were in CN1. That's all about communication and the niceties of life. I wish I was more of an inspirational speaker, but I hope that you get my point. With that said, I will say farewell from Second Life, and hopefully I'll get to meet with you in real life or Second Life sometime real soon. Okay, bye-bye.